Did you know that fatty liver disease, often asymptomatic in its early stages, can progress to a more severe condition called non-alcoholic steatohepatitis, NASH, which is characterized by liver inflammation and cell damage? This serious health condition is one of the leading causes of cirrhosis in adults, and it is a medical concern that deserves our awareness and understanding. Fatty liver disease, also known as hepatic steatosis, is a condition where excess fat builds up in the liver. This process typically begins silently, without showing any signs or symptoms. In fact, it's not uncommon for individuals to live with fatty liver disease for several years without even knowing they have it. It's a silent invader, slowly progressing and potentially wreaking havoc on your health. From its asymptomatic early stages, fatty liver disease can evolve into a more serious condition known as non-alcoholic steatohepatitis, or NASH. NASH is a form of fatty liver disease that causes inflammation and damage to the liver cells. This inflammation is a significant departure from the initial, seemingly benign phase of fatty liver disease, marking a turning point in the disease progression. This evolution into NASH is not just a simple progression, it's a leap into a much more dangerous territory. With NASH, the liver becomes inflamed, its cells damaged. This damage is not trivial. It can lead to scarring of the liver, a condition known as fibrosis. Fibrosis is the liver's response to injury, an attempt to limit the damage and repair itself. However, as this cycle of injury and repair continues, scar tissue can build up and disrupt the liver's function. If fatty liver disease continues to progress and fibrosis isn't managed, it can lead to cirrhosis. Cirrhosis is the final stage of liver fibrosis, and it is associated with many severe health complications including liver cancer. Once a person has cirrhosis, the damage to their liver is irreversible, and it can dramatically reduce their life expectancy. Can fatty liver disease be prevented or managed? Well, in some cases it can be triggered by rapid weight loss. Rapid weight loss can cause the liver to release stored fat into the bloodstream in large amounts. This sudden influx of fat can potentially overwhelm the liver's ability to process it, resulting in a dangerous condition known as acute fatty liver of pregnancy, AFLP. This condition can be life-threatening for both the mother and the unborn child. It is not the only health risk associated with fatty liver disease. It is also linked with an increased risk of cardiovascular diseases, as well as other metabolic disorders such as type 2 diabetes and metabolic syndrome. The relationship between these conditions and fatty liver disease is complex and multifaceted, and research is ongoing to better understand these correlations. Now you might be wondering, how common is this condition really? Well, the prevalence of fatty liver disease is much higher than you might expect. In fact, it is estimated that fatty liver disease affects about 25% of the global population, making it one of the most common liver diseases worldwide. Fatty liver disease isn't just an issue for individuals, it's a global health concern that affects millions of people, and its prevalence is only increasing. Despite its commonality, it's a condition that often goes unnoticed and undiagnosed, silently progressing and potentially leading to severe health complications. Fatty liver disease is becoming increasingly common, affecting an estimated 25% of the global population.